Jason, welcome.
Thanks, Doc.
So you've come in to do a detox from alcohol before going to residential rehab, yeah?
Yeah.
That's fantastic. So tell me a bit about yourself. How old are you?
Just turned 50 not long ago, 51 now.
Yeah. And who do you live with?
I live with Mum. She's getting older now though.
Yeah. Yeah. And so detoxing from alcohol and going to residential rehab. So have you ever been to like the detox unit before?
Yeah, I've been to detox and I've been in hospital because of my drinking as well.
Yeah, yeah. Have you ever been to a rehab before?
No.
No. But you have detox before. How did that go?
Well, I get pretty sick,
Yeah.
so they give me heaps of Valium when I'm in there.
Yeah.
I've had some seizures before in detox and in the hospital as well.
Okay, sure, all right. And so that's when you've been withdrawing, you've had seizures. Have you had seizures at any other time?
No, only when I'm trying to stop drinking.
Sure, okay. And so how long has alcohol been a problem for you?
Oh, most of my life really. I think I started drinking about 14.
Sure.
Like that, so, but the last few years it's probably worse. I'm getting sicker all the time.
Yeah. And so when was the last time that you detoxed?
About 7 months ago or something, or earlier this year I think.
Yeah. And how did you go after the detox? Did you have any period of time not drinking?
Oh, not really. I think I maybe a few days or something, but then I just started drinking again.
Sure. And so what made you decide to go to rehab?
Well, Mum's really worried about me. She's seen me have seizures before I've gone to hospital, so she's worried. And my GP reckons if I don't stop drinking at some stage, I could die because my liver's not very good.
Sure. Okay. And so since that last detox that you did, have you been drinking every day?
Yeah, I'm back on the port now as well because well, that's the cheapest thing to drink. So I get really crook. I feel like shit every day in the mornings because of the port. So
sure. And how much would you drink each day?
Most days I drink probably a 2 litre bottle. When I get paid, I'll drink a little bit more. Sometimes I'll drink spirits when I get paid in the first couple of days, but most of the time it's a 2 litre bottle of port.
And do you ever have any alcohol-free days? Any days off drinking?
Oh, not since the last time I was detoxed, I think.
Sure. Okay. And in terms of other substances, do you smoke tobacco?
Not very often. I don't really like tobacco much.
Okay.
Sometimes if I'm with a few mates and that I'll smoke a few rollies, but not regularly.
Sure. Okay. Sure. And how about cannabis? Do you ever smoke any cannabis?
Yeah, I've smoked weed all my life. I don't really want to stop that, to be honest.
Yeah.
Obviously, if I go into detox, I've got to stop it, but it's not a problem, I don't think, really.
Okay, sure. And how much cannabis would you smoke each day, do you reckon?
Oh, about, I don't know, half a 25 bag.
Okay. And do you smoke it like in joints or smoking like cones?
Just in a pipe.
Okay,
Yeah.
sure. And so just smoking it straight or mixed with tobacco?
No, just straight.
Yeah, okay. And in your like 25 bag, how much would you be getting? Would it be like?
Oh, I don't know.
Like
3.5, 4 grams or something.
Okay, sure. So smoking probably like maybe 1.5 to 2 grams a day.
Something like that.
Yeah. Have you, so in the past when you've done a detox from alcohol, you would have also been detoxing from cannabis. Did you have much in the way of cannabis withdrawal symptoms?
Don't think so. It was more feeling sick from the grog.
Yeah.
I think so.
Yeah. And how do you think you'll go not being able to smoke cannabis when you go to rehab?
haven't really given that too much thought, to be honest. Probably okay, I reckon.
And do you ever take any drugs that we call benzos? So that's things like Valium, temazepam, oxazepam, things like that.
I've had Valium when I've been in detox, and in
Sure.
hospital, but I don't take them otherwise.
Sure. And do you take any opioids? So that's things like codeine, oxycodone, things related to like morphine, nothing like that. And do you ever use any amphetamines?
I've tried amphetamines, but I don't really like it.
Sure.
It makes me really anxious and paranoid.
Sure, okay. And anything else, so one that's out there is called GHB. Have you ever heard of that?
Yeah, I've heard of it, I never have it.
Used it, yeah. And have you ever injected any drugs at all?
No.
No, okay. And so just going back to the alcohol, you've done a couple of detoxes in the past. Have you ever tried any medications to help reducing your risk of relapsing?
The GP wanted me to start some, I don't know whether maybe Campril or something, but I never got the script.
Okay. Sure, okay. And you mentioned you've got problems with your liver. Do you get bloods done?
I'm supposed to. The last time I got bloods done was maybe when I was in hospital last, I think. So,
Sure.
yeah.
Do you see a liver specialist at all?
I have seen them at the Royal Adelaide, but not for a long time.
Yeah.
But they just keep telling me I need to stop drinking.
Yeah. Have they told you that you have cirrhosis?
Yeah, because I get my tummy gets swollen and really sore, and
Yeah.
they've said it's related to drinking and it's my liver.
Sure, okay, yeah. And do you know when would be the last time you had a scan of your liver?
Oh, not for at least a year or so, I don't think.
Yeah, okay. That's probably something that we can organise while you're here, send you off for an ultrasound to have a look. And have you ever had any problems with like bleeding in your gut?
Don't think so.
Okay, that's good. And any other like medical problems, things like blood pressure?
Yeah, I've got high blood pressure. I'm on tablets for that. And just the seizures is the other thing.
Sure. Sorry, did you say you're on blood pressure medication? Do you remember which one?
Telmisartan.
Okay. Do you know off the top of your head what dose?
Maybe 40 or something like that.
Okay. All right. We can double check
Yeah.
it. Did you bring it with you?
Yep.
Great. Any other regular medications?
Not for a while. I've been on Cipramil before, but I
Yeah.
stopped taking that, I don't know, a few months ago.
Yeah.
I don't think it really worked much.
Sure.
Didn't help.
Yeah. And was that for anxiety or depression?
They thought I was depressed,
Yeah.
but I don't know. I was drinking heaps at the time, so who knows?
Sure. Okay. And have you ever seen a psychologist or a psychiatrist?
Years ago I saw a psychologist, I think, but not for a long time.
And were you diagnosed with depression, or have you ever had any other mental health diagnosis like bipolar or schizophrenia?
Just depression, I think they said.
Sure. And have you ever self-harmed?
No.
Or tried to take your own life?
No. No, I
so-
wouldn't do that to them.
Yeah. And so recently, have you been having any thoughts of like self-harm?
No, I'm sick of feeling sick in the mornings. That's the main thing. No, I'm not going to hurt myself because, as I said, it upset mum.
Okay, great. Okay, so what we'll do from here is we'll do a little bit of an examination. So, have a listen to your heart and lungs, have a feel of your tummy, take your blood pressure, and we'll get some bloods as well, check how that liver is going.
Yep.
And organise an ultrasound of your liver because you haven't had one for a while, so that's a good idea. And so for your withdrawal, because you have mentioned that your liver's not great, we'll have a look at the bloods, but we'll probably use a medication called lorazepam rather than the diazepam.
Yep.
It's just a little bit safer with the liver, but works just as well. and because you've had withdrawal seizures in the past, we'll load you up with plenty of lorazepam
Right.
to try and prevent a seizure from
Good.
happening.
Yeah, good.
And the nurses will be doing OBS on you regularly as well to check
Mhm.
your withdrawal scores.
Yeah.
And the other thing that we'll do is give you some thiamine.
Mm-hmm.
You might remember that from before. So
I've had tablets of thiamine before, but I've never had chased it up after detox.
yeah. So you might remember from previous days at the detox unit, we load you up with a good amount of vitamin on your first day.
Mhm.
It's an injection.
It hurts like hell.
It does hurt like hell. It's quite painful,
Mm.
but it's really important just to get a good amount of thiamine into you, because if you don't have enough thiamine, you can get very confused, and we might end up needing to send you to hospital.
Yeah.
So we just boost up your levels, and then we keep going with the tablets.
Yeah.
And we can have a chat maybe a bit later in your stay about whether you might benefit from medication, maybe to help reduce cravings for alcohol.
Mm-hmm.
And so yeah, we'll keep an eye on things overnight. If you have any other symptoms, like
Yeah.
if you're feeling sick, headache, anything like that, let us know.
Yeah,
We
yeah,
can help with
yeah.
some medications to help with those sort of symptoms. All
Yeah.
right. Do you have any questions at all?
No, look, I feel alright now, but I had a drink just in the car park before I came
Sure.
in, so I'll probably be alright till later today, I suspect.
Yeah, okay, sure. All right, so we'll keep an eye on
Yeah.
your breath alcohol level.
Yeah.
And once it gets below 0.1, that's when we start giving you lorazepam to
Yeah.
help,
Good.
get ahead of the withdrawals
Yeah.
before they get too severe.
Alright.
All right.
Good.
Okay, so we'll get you to your room and get you settled in and start doing some obs and things, okay?
Alright.
All right, great.
Cool. Thanks, Doc.